So for this video, we're going to show how to draw blood, the normal drawing blood techniques. For some cases, we will use the piccolo, the CBC, and the hemoglobin, depending on the case or patient. Blood draws are used a lot for the PRPs. Most often it'll be the thing that is normally done. Piccolo and CBC will be done for pre-ops. For this video, we will be doing a blood draw. You're going to have the patient look for veins. Some veins are visible. Some patients will be easier to find it. Others you'll have to put a tourniquet on. And you're going to wrap it like this so that it comes off easy. You'll have the patient turn his hand out a little bit. Extend his forearm. You can see the veins coming in right there. If you have a patient that the veins are harder to see, after getting consent, you can always tap, get blood flow, or just a little scrub. And when you clean off the patient's arm, you're always going to do a circle, going further and further out, moving all the bacteria outwards. Tourniquet can only be on for about a minute before blood will start lysing. So for the PRP or blood draws, you're going to need a few things. The PRP tube, which is done for PRPs. You need the Vagutainer and the needle. Those will always be used for any blood draws. For CBC and CMP blood draws, you also need the green tube and the lavender tube. The way that I begin with this is I begin setup before I present it to the patient. Each CA sets up a little differently. At the end of the day, it's kind of the same thing. I straighten the tube out so that way it doesn't pull and make it harder for me. Once you have it set up, we will proceed to the blood draw. Needles always go in the sharps container. Ask the patient if they have any troubles with blood draws. Do you have any issues with blood draw, sir?
No.
For the patient's comfort, I put a pillow under their arm. I'm going to go ahead and clean it first. Circles again, going outwards. Put on your gloves. Go ahead and push down for me a little bit. Tourniquet on. You want the tourniquet on tight enough that there's a little bit of give right there. But ask the patient, make sure that it's not cutting into them. Is it cutting into you?
No.
Have the guys nearby. Pump a few times for me. And hold it tight. One last time cleaning the surface. Circles out. Have the tubes in your left hand, needle in your right. When you're ready, take off the cover. We're going to top the skin so that the vein doesn't roll. And 45 degree, and 3, 2, 1. You see a flash, put the tube in, blood will start flowing. For this demonstration, we only need a little bit of blood, so you'll release it. Next tube, get the blood, next one, be alright. As the last tube fills, you'll release the tourniquet, take out the last tube, set the gauze there, and then pull out the needle. Have the patient go ahead and hold the arm. Make sure the needle is up in the air. Close the needle. Needle goes directly into the sharps. Go ahead and take the gauze from the patient. Check the wound. See if it's bleeding. Offer the patient a Band-Aid. Would you like a Band-Aid?
Yes.
And that is blood draw. So we begin with the piccolo. This is going to be this one. You're going to grab the package, bring it in here. All of this will be done on a white towel that can be found in the pre-op room with the machines. Begin with opening it. For drawing the blood, you'll go all the way down and then you'll let it come up. You'll go past the first click. And then when you're setting it in the piccolo machine, there's an arrow with a dot. Has an opening. You're going to bring the tip of the micropipette into there. You're going to go down to the first where it stops you, trying to get no air bubbles. It'll go all the way through. You'll come back out. You need a little bit more blood. Go in, get a little bit more blood. Come out here, make sure there's no air bubbles. You're going to set this right here in the hole and just to the first, right there. You'll see there's some arrows over here. That line is where you're filling it up to without any air bubbles. This will go into the piccolo machine. There's a little circle on the bottom of this. It goes right here in the circle that is on the machine. Once it sets in there, it sits flat, and all you'll do is click close. The machine will close, and it'll begin to analyze the sample. You'll put the patient information in, and it'll analyze. So next we will set up the CBC machine, again with opening up the cartridge right here that goes in the machine. This is what it looks like. There's a little insert right here, which is where we put the blood, and then we put it in the machine. We will be using the purple tube. There are these little dispensers that can be attached to the top of the tube. Top goes right in there, just push it in, and it'll fit in the tube just like that. Once you have it in the tube, you'll grab this piece. There's a little hole right here. You'll set it like this, and you'll give it a little push, and blood will start to come in. You'll see it fill up to the line right there. You'll do it on both sides. Once both of them are filled up, you'll grab your little tab that'll go in the machine. You're going to put it in right here, and it clicks into place. You'll hear a snap. Once it's snapped, you'll know it's in. Do a quick test. You'll insert the cartridge similar to how it shows you on the screen, and then you'll take it right there, push it in, slide it in like a floppy disk. You'll enter the patient ID, and it'll begin to test. Generally, we do the Piccolo first because it takes longer. Then we'll move to the CBC and get that going. Lastly, we'll move over to our hemoglobin. Just open the container. These little strands can be found in the HemoQ HB801 little container. For these, you just need a drop of blood. You can either do it in a needle prick, or you can get it out of here while you do your CBC. So you're going to load up blood, just pumping. You just need a little bit. Blood will accumulate in this lower portion. You'll just get the blood with that little circle. You'll use the micro pipette just to get some. Bring it right here. And you see as the circle fills up, and you'll just drop it in there. It's fine if you overfill it. Similar to the picture that it shows, you'll just set it in there like that. Just push it in. That'll give you an instantaneous reading. His hemoglobin is 15.8. This will go in the red biohazard container. Before the tests are done, go ahead and keep the tubes out on the white towel. This is used just in case any of the test results come back inconclusive. This allows us to run more than one test if needed. The solvents in both tubes allow the blood so that it won't coagulate, allowing us to run multiple tests if we need. These should never be left out longer than about an hour. The exams usually are pretty quick. As you can tell, the CBC is already done. The Piccolo is almost finished. Hemoglobin is done. Once the test results have come in, you can get rid of them. Perfect timing. Both analyses are done. For the Piccolo, you'll click open. This will show all the results on the screen. You click close, and you'll throw this away. Both samples will go into the red bin. And then it says right here, and then print it, and then give in to the provider. With these, you'll just go ahead and collect. They will go in the red bin. I usually put them in a glove. You capture all the blood, that way no blood anywhere, and just run to the red bin. The rest of the trash will go into the trash, and we'll move over to the PRP. It'll automatically print. The results will come on the Piccolo like this. Rip it off. This will be what you give to the provider. For this step of the PRP, you will need the proper attire. You need a mask, gloves, and if you have glasses, that counts. Otherwise, you need to put on goggles. Next step of the PRP, we will come over to the machine, the centrifuge. In each location, it is located in a different spot. Talk to the clinical lead, and they will show you exactly where it is. You'll begin with taking out the tube. You're going to level it out to the blood level. In this case, it is not level. If we were to try and spin it right now, you will hear a rattle and a loud shaking noise. This can cause damage to not only the PRP, but anyone around the machine. Crucial step is making sure that it is level. So in this case, we will pour out some of the water, get it level, and then we'll begin spinning it. Now that the tubes are level, we will place them on separate sides, again, making sure that it is level. One on each side, directly across from each other. If you were to do 3, you could do a triangle, 1, 2, 3. If you were to do 4, similar, they just have to be balanced. Similar to a washing machine, you don't want it to shake. Then you'll cover them. The lid will close, and you'll hit the spin button, and it'll begin. You'll stand here for about a minute, make sure that it doesn't start shaking. As you can tell, it's properly leveled. It's not shaking. It's going pretty smoothly. It will make some noise. That's just the PRP machine. It's getting up in RPM, which is going to allow the blood to separate from the plasma. We're trying to get the platelets to inject back into the patient. The providers will do all the injecting. We just prepare for them. As the spin comes to completion, the machine will slow down. You'll hear a beep right there. It means the top is unlocked. You can open it up, and you'll grab the tube. You'll see the separation between the blood and the platelets. You'll see the separation of blood from plasma, which has the platelets in it. The plasma right here with the platelets, the blood has been pulled to the bottom. This is the solvent. It's gone through. In most cases, this will be very clear. In some cases, it'll be a little cloudy. That's just cholesterol. There is no alarm. In some cases, if it is extremely cloudy, you will let the provider know and they will decide whether we will proceed with PRPs or not. Next, we will take out the platelets. So you will get your syringe. In this case, it'll be a 3cc syringe. I like to prep my syringe, give it a few pumps so it's easier. You'll grab a pink needle, 18 gauge. This will go on the syringe. Pull it back, pull the needle. You'll grab the tube. I use the side of my hand to guide the needle in and then give it a little push. Once it's in, you're going to continuously pull back. You do not want to let it go back in. The tube is pressurized. If it goes back in, there's a chance that it can splash or it can explode. So we'll pull through, then push the tube off. Needle, safety, take off, and you have your PRP. Next, you will attach the 23 gauge to the syringe, and we put it in here. This will be given to the provider. For all cases, you'll use a 23 gauge. Sometimes you'll use a spinal needle for hips or certain injections. Never use smaller needle than a 23 gauge. The PRP, the platelets, once they go through, anything smaller than a 23 gauge, they will begin to lyse and the PRP will lose effectiveness. For best results, it's 18 gauge or a 23 gauge. For the patient's comfort, we use a 23 gauge because it's less of a poke. And you'll just make sure there's no air bubbles. And this is what we will give to the provider. Needle always goes into the sharps. Definitely make sure you have the safety top down so you can't poke yourself right here. There's no chance I can poke myself. Put it in there, close, open, and that's it. Lastly, the tube will go in the red bin. And that concludes our PRP tutorial.